Now, after completing the surgical anatomy of the thyroid gland, we will be learning various triangles which we need to know to operate on the thyroid to get a good exposure of the thyroid glands. Now, here recently we have many triangles, but we don't have to know each of the triangle in depth. The various surgical triangles which we need to know, which will be aiding us during the thyroidectomy operations to help to know the avascular region, to help localizing any neurovascular structures, so to prevent the damage of that particular structure. So if you have not watched till the first episode of the thyroid gland, please go to the playlist and search TFS-8. That is where we have discussed the surgical anatomy of the thyroid gland. So first triangle that we are going to discuss here is the Beard's triangle. Now Beard's triangle is something that is bounded by, this is the common carotid artery. Okay, and the base is formed by the common carotid artery. Okay, and you have this superiorly, you have this inferior thyroid artery. This inferior thyroid artery is a branch of this thyrocervical trunk, which is a branch of subclavian artery. Okay, so it is coming like that and giving the inferior thyroid artery. Okay, so this is superiorly bounded by inferior thyroid artery, and here it is, the base is formed by the common carotid artery. And from the first lecture of thyroid TFS-8, you know that after giving the superior laryngeal nerve, this vagus nerve is descending down here, and then it is giving the recurrent laryngeal nerve. This recurrent laryngeal nerve is like here, it is ascending. Okay, so the triangle which is formed in between this, the recurrent laryngeal nerve in the lower arm of the triangle, the inferior thyroid artery in the superior position, and the base is formed by the common carotid artery. This triangle is what is known as Beard's triangle. What is the importance of this triangle? This triangle is important recognizing the recurrent laryngeal nerve to avoid the injury to the recurrent laryngeal nerve. Once you identify this Beard's triangle, you know that recurrent laryngeal nerve is what is forming this border. So you have to be much more conscious while you are dissecting this thing. Now this is what is Beard's triangle. Triangle is also known as Riddle's triangle. Now similar kind of triangle is your Simon's triangle. Through this triangle, the recurrent laryngeal nerve crosses. Okay, so basically if you see that this triangle is again having common carotid artery, again having inferior thyroid artery. Okay, common things, and esophagus medially. You see this is the common carotid artery, and then this here somewhere around will be inferior thyroid artery, and this is cricothyroid muscle. So sometime they might say cricothyroid muscle, sometime they might say that inferior thyroid artery above, and this side your common carotid, and this side you will be having esophagus or trachea medially. So now this time this is the triangle which is Simon's triangle. I mean, if you see the Simon's triangle may external, this is the recurrent laryngeal nerve which is now a content, and this is crossing through this triangle. So what is the difference between Weyer's triangle and Simon's triangle? Okay, you might find this difference hardly in anywhere. So the main difference is that, see, here also common carotid, here also inferior thyroid artery, but here the margin, one of the boundary is recurrent laryngeal nerve, but here this is the boundary. Okay, in Simon's this is the boundary. Medially they are taking the trachea or esophagus, so that this recurrent laryngeal nerve becomes the content, and it crosses through the Simon's triangle. Okay, this is what you have to be remembering. The importance, again, clinically recurrent laryngeal nerve identified intraoperatively to this triangle, and mostly what is used is the Simon's triangle to identify this. Next, coming into Zoll's triangle. Zoll's triangle, here you can see this is a triangle where laterally you have upper pole of the thyroid gland and superior thyroid vessel. So plot it. This is where you have upper pole of thyroid gland, and these are the superior thyroid vessel. This is the lateral side. Okay, then so superiorly you have strap muscle and deep investing layer. Okay, so superiorly you see this is the strap muscles which are actually retracted. You can see this is forming the superior boundary along with the deep investing layer, and medially you have this midline, and medially you have this midline. Okay, so this triangle is what is known as Zoll's triangle. Now what is the importance of this triangle? You can see this is the nerve which is lying here. This is the external laryngeal nerve. external laryngeal nerve during thyroidectomy. Where to find is in the Zoll's triangle. Okay, in the Zoll's triangle, you see this is the external laryngeal nerve. You remember, external laryngeal nerve is a branch of superior laryngeal nerve. So the superior laryngeal nerve gives internal laryngeal, which pierces through the thyrohyoid membrane, and the external laryngeal is coming and following the superior thyroid artery. I have discussed this here. See, this is the external laryngeal nerve coming superior thyroid artery के साथ. Okay. Next, this is Joel's triangle. Okay, so now see, this triangle is very important. The combination of all those triangles which we have discussed is this one. So here you can see in the lateral side, basically you will be having this common carotid artery. Okay, now if I say that the medial boundary is formed by recurrent laryngeal nerve, that yellow one. Okay, and above you have this one is inferior thyroid artery. Inferior thyroid artery. Okay. See, inferior thyroid artery is not arising from this external carotid. It is not from the common carotid. This artery is actually like this behind. Okay, from the thyrocervical trunk. I have shown this image many times. See here. Okay, this is the inferior thyroid artery. Okay, as if it is arising from this artery, but no, this is arising from this thyrocervical trunk, which is a branch of subclavian artery. Okay, so again coming back here. So this triangle is our Beer's triangle, or it is also known as Beer's triangle or Riddle's triangle. It is also known as Riddle's triangle. Okay. Next, if I extend the medial boundary to the trachea or esophagus, then this purple one that becomes total from this side to this side, it becomes your Simon's triangle. It becomes your Simon's triangle. Okay. And if I just take the inferior pole of the thyroid as the superior boundary rather than taking the inferior thyroid artery, then this becomes your Lord's triangle. Now this Lord's triangle, so here laterally you have common carotid artery, this side you have the medial, you have trachea, the medial border of the trachea, and this above you have inferior pole of the thyroid. Inferior pole of the thyroid. This is your Lord's triangle. So here also, what is the importance? You see the inferior segment of the recurrent laryngeal nerve. You are seeing this yellow portion. This is the inferior segment of the recurrent laryngeal nerve. Okay, don't worry, we will be learning this thing again. So just wait. So we have just discussed these three triangles. This one, what I have discussed is Joel's triangle. Here is the Joel's triangle. See, this is the midline. This is the midline. Okay, according to the orientation, this is the midline, and here is the lateral side. Okay, and the lateral side, as I told you, this is by upper pole of thyroid. This is the thyroid gland. You can see this is the upper pole of thyroid forming the lateral, as well as you have the superior thyroid artery, and the superiorly you have strap muscles and deep investing layer. So this is what you need to know from these three triangles. There is something that is known as triangle of concern. What is this triangle of concern? This is the area where most common site of bleeding occurs during thyroidectomy. That means the middle thyroid veins, the inferior thyroid vein, and the branches from the inferior thyroid artery. The branches from the inferior thyroid artery, they are present in the vicinity of this triangle. So while operating, there may be bleeding from this area. That's why this is known as triangle of concern. This is known as triangle of concern. Okay. Now, as you can see, there are lots of triangles which we need to remember when we are proceeding for thyroidectomy operations. So recently, that's why, so to overcome this problem, what is there is known as unified area of danger. What is this unified area of danger? You can see this is very simple. Superiorly, it is bounded by superior thyroid artery. Inferiorly, it has this inferior thyroid artery. And laterally, you can see the carotid sheath is there and its content, that is laterally. And medially, you will be having the trachea. Medially, you will be having the trachea. So this is the area that is formed, is what is known as triangle, that is unified triangle of unified area of danger. This is the unified area of danger. This you can see that this area encompasses all the danger zones which might injure the nerves or vessels. Okay, and this area is made comprehensive so that the operating surgeon can be cautious in this zone, since this is just a single area. Okay, so it is easy for the surgeon to remember during the procedure. Okay, because the triangles are very much precise, no doubt, but what happens, they are not complete. Means if you just use Beer's triangle, it will just give you recurrent laryngeal nerve view. Okay, so it won't tell you which one is avascular, which one area is more prone for bleeding or something else. So these are specific, but they are not complete. That's why this partial caution might lead to injuries to the vital structure. That's why a single area of danger that is easier for the surgeon to remember during the OT. That is why this unified area of danger is this concept was made. Okay. Now we'll be just discussing whatever we have discussed in a summary so that you can remember everything. So first, coming into the Beard's triangle. Beard's triangle, you can see during thyroidectomy, it is used to identify recurrent laryngeal nerve. It is used to identify recurrent laryngeal nerve. You can see this is the common carotid artery. Okay, and you can see this is the inferior thyroid artery, and this is recurrent laryngeal nerve. So this is the triangle which actually identifies the recurrent laryngeal nerve. Okay, remember the common carotid artery is forming the base, the superior is the inferior thyroid artery, and recurrent laryngeal nerve is present in the lower arm. Okay, side by side we have to know the Simon's triangle. The same thing is there, but only what you have to remember that the base is not common carotid artery. The common carotid artery is not forming the base. Your base is cricothyroid, or you can also remember inferior thyroid artery. Cricothyroid or inferior thyroid artery, which is above. Esophagus is the medially, common carotid laterally, and inferior thyroid artery superiorly, or cricothyroid I also told you here. See, cricothyroid muscle or inferior thyroid artery. Okay, you can remember in that way. And nerve is crossing through this triangle. Okay, understood? Next, coming into triangle of concern, I just told you that this is where the small branches of the arteries and veins are there, basically the inferior thyroid artery, which prone for bleeding. Okay, if this is not dealt carefully. Okay, this is the commonest site for bleeding in thyroidectomy. You don't need to remember the boundaries, but if you want, you can remember from here. Next is the Lor's triangle. Lor's triangle, I just told you that the inferior portion of the recurrent laryngeal nerve is present. Okay, see here, I just told you now, this is the Lor's triangle, yellow one. This is the Lor's triangle, and this is the recurrent laryngeal nerve passing like this. So the inferior portion of the recurrent laryngeal nerve is present in this Lor's triangle. Recurrent laryngeal nerve triangle is also an inverted triangle, is also helping you to localize the recurrent laryngeal nerve, because here the recurrent laryngeal nerve is exiting as a single trunk. Okay, at the thoracic inlet. As I told you, the apex is formed by thoracic inlet, and this is inverted triangle, so apex will be below. Okay, baki boundaries you don't have to remember, because medially trachea, laterally you have strap muscles, and superiorly you have the inferior pole of the thyroid. You don't have to remember these things. Now, what is cricothyroid space of Reves? The cricothyroid space of Reves is an avascular plane. This is avascular plane. Okay, you can see this is the avascular plane. So if you see, this is the upper pole of the thyroid. Okay, this is the upper pole which is retracted, and this is the cricothyroid. So if you carefully observe, between this area, which is the avascular space between the cricothyroid and the upper pole of the thyroid, this is what is known as the Reves space. Okay, what is the importance? As I told you, it is avascular space. It is the avascular plane. So identification and opening here will preserve one structure, that is the external laryngeal nerve. You can see the external laryngeal nerve, that is a branch of superior laryngeal nerve. Okay, that is present there. So I have discussed each and every triangle possible, okay, in this slide. Okay, so yeah, it might be very much difficult to remember everything, so you just please remember on Beer's triangle and Simon's triangle and Zoll's triangle, these three triangles. Okay, these three are important. Okay, another is the unified area of danger. Just go through this image where all the triangles are mentioned. Okay, so Lor's triangle for the inferior portion of the recurrent laryngeal nerve. Okay, Simon's triangle, Beard's triangle, or Riddle's triangle for the recurrent laryngeal nerve, and this you have to remember. So this is all you have to remember. Thank you.